Hello, everyone. We will begin the webinar presentation in exactly 1 minute. Thank you. Hello, thank you for joining us today for our discussion on mental health on campus, supporting first-year students. My name is Brian Nito, and I'll be your moderator today. I'm excited to be joined today by a panel of experts in the field who I will introduce shortly. As the American Psychological Association reported, 1 in every 3 freshman students have struggled with mental health in college. Each panelist will be sharing their insights on this topic and what their respective campuses have done to support first-year students. But before we kick off the webinar, I'd like to set some webinar ground rules. This presentation will be recorded. A copy of the recording will be sent after the presentation. All attendees are in listen-only mode, but if you have a question, please submit on the screen in the question box. Feel free to also connect with us and live tweet at us at our Twitter handle @Cognito with the hashtag CognitoWebinars. Our team will be monitoring our Twitter for any questions that might come through. My name again is Brian, and I'm the Director of Client Experience here at Cognito. And my team and I work with folks like our esteemed panelists to assist in promoting Cognito's mental health programs. For those of you that are not aware about Cognito, Cognito is a health simulation company that creates a suite of mental health simulations to train faculty, staff, and students around the topic, including how to approach students showing signs of psychological distress and talk with them about seeking the help that they may need. These simulations are all listed in the National Registry of Evidence-Based Programs and Practices, or NREP, and all of our simulations that we're speaking about are evidence-based and utilized by over 350 schools nationwide. As I mentioned, Cognito has implementation experts within my team that work closely with campus leaders like our panelists to roll out our mental health programs. Through these partnerships, we not only have seen over 2 million users, but some impressive strategies and trends. Some of them are listed here on the screen. For example, we've seen some amazing campuses partner with student organizations like Student Government Association, Active Minds, fraternity sororities. We've also seen messaging from high-level administrators, from provosts or deans. Our partner at Washington University, St. Louis, took this approach among other Cognito campuses. We've also seen institutions take a curricular approach and embed within freshman general education or life skills courses that each freshman take as a transitional requirement, like the University of Louisville. Lastly, some of our institution partners are creating mental health awareness days, like a Cognito Day, similar to what was launched recently at Princeton University. Now, before I introduce our panelists, I wanted to just get a pulse of our attendees today and ask on the screen, you'll see a question pop up. The question that I wanted to understand is, does your institution currently mandate first-year students to complete a mental health training program? And you should see that question shortly. Great. And so I'm going to take a moment just to see some of these results and see what you all are responding. Great. These are some great answers that we're seeing. So we'll go ahead and look at some of these data, and we'll go ahead and reflect them back at the end of the webinar. Please go ahead and submit your answers in time for this ongoing question as coming up as a question box. So we're seeing a lot happening, so I'll be sure to reflect that back at the end of our webinar. Now, I wanted to go ahead and introduce our esteemed panelists, as you see on the screen right now. We are joined by Layla Mataraya, Dr. Kathy Zakarian, and Sarah DeWitt. Each of them come from a very diverse college partnerships. Some are smaller schools, some are larger institutions, some are private and public, and each share a different perspective on how they're supporting their first-year students. So I'm going to go ahead and introduce our first panelist. Layla, are you there? I'm sorry? No, I'm sorry. Actually, Kathy. Kathy, are you there?
Yes.
Yes.
Great. And Kathy, why don't you introduce yourself, and you can go ahead and begin.
Thank you. So I'm going to talk a little bit about how we've incorporated Cognito into our first-year experience class curriculum. And the most important part of doing that is receiving support from leadership. And I initially met with our Dean of Academic Services and College Transitions, who oversees Penn College's first-year experience class. I explained to him that one of the goals of our SAMHSA's Garrett Lee Smith Campus Suicide Prevention Grant was that we wanted to systematize a comprehensive, ongoing educational campaign for all students and to engage the campus community as a whole in awareness, prevention, and intervention to address mental health and suicide. Our dean then agreed to help build Cognito into our FYE curriculum in the first 3 weeks of the semester, along with the topics of sexual assault as well as alcohol abuse. As you know, this is a critical time in the semester to address all 3 topics as students are dealing with the transition to college and its associated stressors. The first-year experience has course outcomes, and Cognito falls under the one that's essentially outlining life skills activities. The outcome is to discuss and apply skills related to personal life, including managing stress, time, responsibilities, financial resources, and their health and well-being. It's important to note that many of the staff and the topics are competing for a spot in the curriculum. So given the FYE class, this is a great avenue to share information with new students. And so we were very fortunate to have that. I'm sorry, I just noticed that. Could you advance the slide to my talking points?
Yep, we're going to go ahead and do that right now.
Okay, there we go. Actually, there's one before that. Was there the receiving support for leadership? Yes,
yep.
This one. Sorry about that.
There we go.
Nice. So in order to do all of this, we wanted to provide some training to the FYE instructors. Many of them are not necessarily comfortable talking about suicide prevention and didn't have, all the tools to be able to do so. So the key to being able to implement this, the dean holds an FYE startup meeting in August where they review the core requirements of the FYE syllabus. And this is where our coordinator of student health and wellness attends the meeting and provides the rationale for Cognito to the instructors and explains the importance of building a lesson around it. There's certainly added value when there's additional time that's allotted afterwards to be able to process and discuss the experience together as a class. We find that students want to talk about suicide, as it's touched many of them before they've arrived here at college. So the resources are placed on our course management system for the instructors to access, and we walk through that during that meeting to familiarize themselves with that. You could go to the next slide, please. So our coordinator of student health and wellness created an online resource video for instructors and basically narrates the PowerPoint contents to them, which outline the nuts and bolts of the course. This has been a very critical, successful piece for us, given that this PowerPoint is used to familiarize themselves with the training, but it's also the same PowerPoint then that they use with the students to introduce the assignment to their class. So I'd like to take a little time and walk you through the slide topics that are addressed in this PowerPoint. So the first one is that we, introduce what is Cognito. So we explain that this is a gatekeeper training for students. It's a 30-minute online learning experience designed to help improve coping and helping skills. The fact that the training is going to help identify common signs of distress and help students learn more about the resources that are available, both on and off campus. We then outline some Penn College data specific to student mental health. So we share our own data from the National College Health Association survey, and we give specifically the percentages of students that are feeling overwhelmed by all they have to do, the percentage of our students that are experiencing a tremendous amount of stress, the percentage experiencing overwhelming anxiety, and the percentage feeling so depressed that it was difficult to function. So these statistics then provide some compelling support for the need for this gatekeeper training. We also insert a slide on stress and performance. So we provide a brief description of the relationship between performance and the level of stress, and discuss how too much stress becomes distress, and how distress decreases performance, and the fact that students who utilize support services when needed tend to cope much better with stress. We then introduce and talk a little bit about the at-risk for students training. And we explain that the training shows how to have challenging conversations with their friends and their peers around mental health and how to motivate them to seek help. The training teaches students how to practice and learn, specifically how to use open-ended questions and reflective listening and other motivational interviewing techniques. We then share information about the technical requirements. Really basic things so that they know that they need to make sure that they have access to sound. The fact that it's not mobily responsive, so that they need to use a desktop or a laptop computer. We talk about accessing the course. So we show them a picture of the login site and explain how to create an account and other practical pointers and recommendations. We talk about identifying yourself, the fact that Penn College's enrollment key is used by all students when setting up their account so that they know about that. And then we explain more about how to get started. So we talk about the details of the course, how to start it, as well as what to expect during and after the time that they're taking the course. So for example, the course begins with a brief survey. The fact that you don't have to complete the course in one sitting. That there's 5 components of the course that provide different scenarios, including warning signs and guidance for assisting friends in distress. And an email confirmation is set upon completion, so they know what to expect. We also outline the in-course resources in terms of how to access and use the user interface and all of the links that are associated with that. And then we have a slide, of course, on where to find help, both for resources for when someone is in crisis, such as our counseling information, our college police, as well as our county crisis helpline, and the National Suicide Prevention Lifeline. And then we also provide our on-campus resources, such as counseling, college health, residence life, disability services. And lastly, then we provide the helpful links that are resources that are provided by Cognito. Additionally, then we give the faculty the talking points so that they can utilize the discussion guide to be able to have that conversation then with their students and familiarize themselves so that there is that follow-up discussion after everybody has completed the training. We certainly encourage all of the instructors to take the training so that they are well aware of it, and that obviously will enhance the conversation as long as they've taken that as well. Just want to highlight a couple key accomplishments. By having this as part of our FYE course, we've been able to have a 97% completion rate with our first-year students. We've trained over 3,800 students since we started this in spring of 2016. And that's when we first piloted it. And I would highly recommend a pilot before you roll out, particularly in a fall semester. That was another success for us too. So we identified several FYE instructors who were willing to do a pilot with us to test it out with their spring class, and so that they then provided feedback to us, which was used then to prepare, excuse me, for our full rollout then during the fall of 2016. I just wanted to note too that we then track the participation through the Cognito usage reports and provide names of those who have completed the training at the end of weeks 2, 3, and 4 of the semester. And we provide that information to the dean, who then shares that with the FYE instructors so they can see who of their students have yet to complete it and who has completed it. The training itself is considered a course assignment, and that's worth points towards their final grade. And the biggest challenge that I want to highlight is the fact that it is easy to miscalculate the completion time. Some students take longer than others. They will not all complete this in 30 minutes. Some get it done in that amount of time. Some are going to take upwards to 60 minutes. So when you have a 50-minute, 45 to 50-minute class, everyone's going to be finishing at different times. So we strongly encourage faculty to have students complete this as an out-of-class assignment, which would then allow the time for the lesson and the class discussion during that second week of class. And that's what I have.
Thank you so much, Dr. Zakarian. I really appreciate your insight on how we're a part of your FYE first year class, as well as other important resources. Is very, very impactful. Thank you for sharing.
Absolutely, my pleasure.
Next, I'm going to go ahead and introduce Layla. Layla is the health educator of health promotion and wellness at the University of Chicago. Layla, are you there?
Yes, I am. Thank you. All right. So yes, thank you for inviting me. So I just want to mention a little bit about the department that I work for at the University of Chicago, and this is the Department of Health Promotion and Wellness. It's one of 3 departments within Student Health and Counseling Services. So there's Student Health, Student Counseling, and then Health Promotion and Wellness. And so HPW for short just really empowers students to make healthy lifestyle choices to advance their academic, their personal, and professional goals. We utilize evidence-based practices to apply UChicago health behavior data to create programming tailored for our students. And we utilize a public health approach, and we've really focused our efforts on these key 7 facets of wellness that you see here to develop innovative initiatives that address the needs of our students. And we work collaboratively with campus partners to enhance the U Chicago community, to promote lifelong healthy behaviors, and to empower students to improve their quality of life and to reach their highest potential. And so I wanted to kind of mention some of the mental health initiatives that we offer, not only in our department, but also in counseling too. And so one of which is BASICS, and I'll just briefly mention some of these resources that we have. BASICS stands for Brief Alcohol Screening and Intervention for College and Graduate Students. And it's a chance for students to just kind of explore their substance use behaviors in a non-judgmental and private environment with one of our health educators. Mental health first aid is a very popular one that we have here. It's offered for students and faculty and staff. This program is an 8-hour training, and participants identify the signs and symptoms of a mental illness and how to help someone that they're concerned about, and how to refer them to appropriate and professional resources. Mindfulness meditation is also very popular amongst our students. They learn the basic techniques of mindfulness meditation and other mind-body skills to relax their body mentally and physically. And our peer health advocates are our student groups that talk to other students on various health topics. We have our In Touch students, which promote healthy relationships and sexual health. We have Mind Over Matter, which is the student group that I manage, and this group helps to cultivate a culture of care surrounding mental health and helps to break down the stigma. And then the Body Positive, which helps to promote positive body image. Our Refresh Sleep program, students learn the skills and strategies to improve their sleep and achieve more restful nights and wakeful days. And this is just an email they receive once a week for 7 weeks on just tips and information. Our stress kits are pretty much kits that have effective stress relieving supplies, so things like Play-Doh, coloring sheets, there's Legos and stress balls, and a whole bunch of fun things for students to check out. Wellness coaching is something new that we just started offering last quarter, and this is a way for students to examine their strengths and values and to learn how to use them to navigate transitions and achieve their desired changes that they'd like to make. Let's Talk is a resource offered from student counseling, and this is just a program that provides easy access to informal, confidential, and anonymous, if they wish, consultations with a counselor from Student Health and Counseling Services. An Academic Skills Assessment Program, or ASAP for short, is also a program that's run by Student Counseling, and this program assists students who are having academic difficulties. And the Campus Health Needs Assessment is really what I want to focus here. This is an assessment that identifies key health needs and issues of the campus community through systematic and comprehensive data collection and analysis. We use the Mobilizing for Action through Planning and Partnerships, or MAP for short, framework to conduct the CHNA. And so this is just a community-wide strategic planning process for improving public health that we tailor to our campus community. So it's been about, we're on the second year of our Campus Health Needs Assessment. And so after about the first year of collecting qualitative and quantitative data through our focus groups and our survey data, the National College Health Assessment, and the Healthy Mind Study, we found that one of the top issues identified on our campus was mental health and mental well-being. And so, our data shows that stigma is still a barrier in students accessing mental health services, and that students are unaware of the many resources that are available to them, both on and off campus. And so this is kind of where Cognito intersects with this. And so Cognito has been implemented on our campus since 2016, but the utilization rate was very, very low. And so after we kind of conducted the data collection of our campus health needs assessment, the college programming office, which is the office that kind of makes these programs mandatory for the freshman students, they came to us and learned about what Cognito does for students, and they really wanted to make this mandatory. And so the college really wanted to try to create a culture of care, and they care about our students' well-being, and they felt that it's important to have a baseline knowledge of things like alcohol, mental health, and sexual conduct before coming to campus. And so this past year, they made it mandatory for all incoming freshmen to complete. And so they have from between July through August to complete it before coming to campus. And so some of the other modules that are required are alcohol EDU and the sexual assault prevention for undergraduates. And so this is required. If they do not finish these modules, they'll have a hold on their registration for winter quarter. And so when students hear that, they're really coming here for their intellectual facet. They get scared and they complete it. So but before that, we would advertise Cognito in our printed materials and on our websites and to deans of students. But we find that students don't need a resource until they need it, until they're in crisis mode. Yes. So next slide, please. Yes, thank you. And so these are some results from just this past year. So we had about almost 2,000 students completed, and we had a 98% completion rate. And so some of the results that we pulled were that when asked if students, or when asked if they recognize when a student is experiencing signs of psychological distress, you can see from in the pre-survey before they took this module, 44% rated high or very high, and then after, it jumped to 80.9%. And then when asked students if they talk with a student in psychological distress to motivate them to connect with mental health support services, you can see that the numbers, increased. And overall, how would they rate the simulation? 60% rated it as either very good or excellent, and would they recommend the simulation to others? 87% said yes. And so you can see that Cognito was very well received from the students, and we find that it's also a great supplement to the mental health first aid training that we do offer. So yes, that's it for me.
Thank you so much, Layla. And I want to just highlight some of these statistics. These are very, very impressive statistics that Cognito does provide for our campus partners. We want to see this change in behavior, these skills acquisition, and we can see that your users are not only able to identify students that are showing signs of psychological distress, but they're willing and able to approach and then, if needed, refer them. So I'm just elated to see some great numbers coming out of the University of Chicago. So thank you for sharing this.
Yes, of course. Thank you.
And before I introduce our next and final panelist, I just want to remind folks we're seeing a long list of questions come in, but for those of you that are eager to ask, Layla, Dr. Zakarian, and Sarah some questions, feel free to enter them in the question box area or follow us on Twitter at Cognito with the hashtag CognitoWebinars, and we'll be sure to add them to the list. And last but not least, I wanted to introduce Sarah DeWitt from the University of Dayton, Ohio. She is the coordinator of health, education, and wellness. Sarah, are you there?
Yes, I am. So to really get us started, if you don't mind progressing to that next slide, I want to start by contextualizing us with some information about the University of Dayton, as I would not be representing the institution well if I did not. So the University of Dayton is a Catholic and Marianist religiously affiliated institution. We're in the Midwest. We're relatively urban. We have about 8,000 undergraduate students. We have a nice split between our in and out of state students. We're mostly white, our students mostly identify as white. And when you look at the age points, we're mostly overwhelmingly traditional aged college students, and 94% of our students, first-year students, live on campus. So some key aspects in terms of garnering support for implementing Cognito really included being mindful of our Catholic and Marianist identity, which really challenges us to bring all individuals and all perspectives to the table, which you'll hear me talk about later. And then we have this really high residential rate. So we knew that moving forward, that was going to be a key partnership for us. So if you progress to the next slide, I want to talk a little bit about the history of, we have a group that does mental health promotion and suicide prevention initiatives on our campus, and it really started in 2014, where we had a independent consultant come to the University of Dayton, did some policy review, protocol review, and really looked at what supports we were offering students, and provided us with some recommendations for us to do better. So as a result of this consultant visit, we had a work group that was established in 2014 to take those recommendations and really see what was the best steps for us next. And this work group really challenged us to have mental health be the ownership of everyone on campus, not just the counseling center, not just our health education office. It really made it everyone's responsibility, which was critical later on when we went to the implementation, because it increased the adoption of the module and really all other related mental health initiatives across the campus. So the work group really developed and found it critical that training have an entry level, like very basic knowledge base, and be very accessible to the community. So in 2015, we piloted different subgroups within the work group that had resources, training, and education. And the training group tested out different modules, including Cognito. And this group really became very passionate about wanting to pursue Cognito for our community. They found that the content really mirrored the mission of the institution. It was accessible, and it had this self-directed learning piece. Being an online module, it was a way to reach a critical mass, and it did what we really needed it to do in terms of building self-efficacy, so that this ethic of well-being and culture of care could truly be cultivated on our campus. So as the work group continued to progress and select the module, the larger group had buy-in. In fall of 2015 is when we launched the module for the first time. We did do a full-out launch as part of our Suicide Prevention Week initiative, and there were definitely some learning moments from that, so I would advocate for that pilot test group, as one of my colleagues had shared. But during our first go, we had over 1,000 students participate in the module, so that was a pretty great get for us. So if you move to the next slide, when we think about strategies and best practices and how we really got to where we are and how we keep moving forward, we have this interdisciplinary team that was really involved in bringing stakeholders across the campus together. Some of the individuals from the first group of individuals in 2014 remained on the committee and continue to serve in that role. And if individuals have discontinued, representation from that area has continued with the representation of somebody else. As we were really thinking about Cognito and how we wanted to implement it, we thought, like, should this be part of our orientation process, like Alcohol EDU is for us, or what messages really do we want to send? Like, how do we want to communicate the value of this module? And we landed on the notion that learning about mental health really it's not just for first-year students, it's for everybody. We wanted to build capacity and continue to engage in mental health conversations as first-year students, but all across their experience as UD students. But we didn't want to miss that critical opportunity of continuing to build skills. So we were like, what helps us kind of land with our first-year students and continue to build that critical mass and develop those skills and capacity across the experience of our students? And that's where we look to integrate with our residential curriculum. So as I shared earlier, we have over 90% of our students living on campus. Our housing and residence life housing process is managed with the residential curriculum, so students have to earn points towards their housing. The more points you have, the better quote-unquote house you get. So we were able to align the goals with Cognito. They actually just aligned very naturally with the learning outcomes of the residential curriculum. Being able to recognize signs of distress and support their peers was clearly part of living in community. So we were able to really integrate that so that way students could earn points towards their housing by completing the Cognito module. It was very accessible, so even our students who were living off campus or maybe abroad for a semester could do it. And we have seen a huge number of students, so about 20% of our students who completed it as first years completed again as second years. So we know that they're continuing to build on that skills and refresh that information, which is so important as mental health continues to be such a critical issue on our campuses. And we know that 67% of college students tell a friend they're experiencing distress before they tell anyone else. So we found that this was so important. We did like very specific marketing and passive campaigns with our housing and residence life. So each year we do a huge push in the fall, starting in September during Suicide Prevention Week and running through World Mental Health Day in October. And then again in the spring, we do, right when students come back to the module, we'll do another big push until about the middle of February. So we'll wrap up this big push for the module on February 18th, which is next Monday. We've gotten great feedback from students. Things like, it's been great because I took conversation skills away, that it was not just about giving advice, it's about relating to the person I'm talking with. And one student actually recently told me that they found the assessment tool at the beginning to be a great opportunity for them to reflect on where they were in terms of their comfort level and experience with dealing with mental health. We also found, though, like this couldn't happen in silos for our students. We had to have a complementary experience for our faculty and staff. So we're able to incentivize the model through our human resources. We have like a system where you can get points to earn money off your health insurance. So this is one of those modules that allow them to accrue points. And we also do like a lunch and learn style. This was really important because if we want our students to have this language, this skill set, and this knowledge, our faculty and staff need to be able to engage in that same language and knowledge base. So coupled together, we felt like interdisciplinary teams, really integrating it with the residential curriculum, because that's a great way to meet a critical mass of our students, and being able to have faculty and staff have a complementary experience were key. But if you move to the next slide, really gaining the support of leadership was driven by this module really not addressing one aspect of a larger plan. So this is the University of Dayton step care model, and it mirrors that socio-ecological approach, so similar to what they're doing at the University of Chicago with a public health perspective. We took on those same pieces. So this is our holistic plan, and you can see at the bottom, like it's focusing on these aspects of self-care and building community all the way up to those crisis response policy level pieces that we know are critical. And Cognito really falls into that developing skills, the like middle portion, lower portion of this framework. to really sell the value of Cognito, we talked to our administration about how it is one piece of this much larger puzzle, but Cognito does the best job at helping build capacity, increasing help-seeking behaviors, recognizing signs of distress in others, and increasing awareness of resources. So this module, because it's accessible and allows students to actively engage in building skills, it's introductory level, and it addressed the things that we wanted members of our community to have. It's been critical to building our ethic of well-being here at the University of Dayton, and all members of our community can feel empowered to take an active role in supporting students who are in distress. So from kind of my experience here being at the University of Dayton and implementing Cognito, my biggest takeaways from this experience overall has been mental health needs to be a shared responsibility for all members of our community, which is why it was so important for us to have those interdisciplinary teams helping select what were the best resources for us. And Cognito really plays a critical role in our overall approach in terms of those developing skills and capacity building and increasing help-seeking behaviors, but we knew that it couldn't be the only part of our plan. That is what I have.
Thank you so much, Sarah. I think you captured a lot of the ongoing trends that we're seeing with some of our campuses, that with any mental health initiative, it takes a village. And that's what we're seeing. And you hit some great key stakeholders to generate some buy-in from. You mentioned the resident's life to human resources. And with any program or any initiative on campus to support students, it really merits reaching around across the aisle to other leaders and other organizations. So thank you for your step care model approach on mental health and your insights. Great. And so before we jump to Q&A, I wanted to relaunch that poll. A few individuals mentioned that they did not receive the poll question, so we're going to go ahead and relaunch that. And the question centers around whether or not your campus is doing any mental health initiatives to support first-year students. And you can see just from the initial responses, we have an overwhelming majority saying that there are no initiatives that are currently going on campus to support. I think we're at 80% to about 8% not sure, 12% yes. So I'm glad we're having these discussions, because it's very important to hear from experts in the field, to hear what they're doing with their resources and how they're working with other partners at their own institutions. So to open up some QA questions, we definitely had a lot come in before the actual webinar. So I want to kick it off with this first question. It's from someone in the audience. What suggestions do you have for colleges that don't have counseling centers? Why don't we start with Dr. Zakarian?
Well, and again, I think that, as Sarah had mentioned too, this really is a campus-wide effort. So, you know, hopefully that there's somebody, whether that is through, you know, if they have like a health services office, or if there are any wellness, you know, type things. This also could be, you know, spearheaded through residence life, any areas that have, you know, that ability to, you know, touch a large amount of students. But I think that the critical piece with that would be to, you know, get the buy-in, the fact that this is a community effort, and that there are, you know, numerous ways to, you know, to promote this. And this, particularly with Cognito, this is something that does not need to be done through counseling, it per se. But I think with all of this, and I think that that's the biggest thing, is that it really needs to be a community-wide effort, and that staff, faculty, administrators all, you know, need to be involved and learning and committed to the initiatives.
Great. Layla or Sarah?
Yes, and I can kind of tag along with that. And I do believe that, you know, a counseling center is, you know, it would be ideal, but it's not it's not required. We in health promotion and wellness, we really try to promote mental health resources. And although we do work with counseling, a lot of what we do is on our own. And so, and I do agree that it does take more than just counseling to promote these resources. And so with the college programming office, we really got their input and their buy-in for this.
So I think from my perspective is these initiatives largely came out of committee work at the University of Dayton. And while I'm sure we can all think of challenges we may have had working on committees and some of the barriers there, we were very intentional about having no one specific office have ownership over the mental health initiatives, because we really wanted that to be a platform to empower all members of our community to be part of the owner. So my information is the contact information, but I can tell you there are so many people who have been involved in driving and moving this initiative forward that if somebody is passionate about it and there are other individuals who are on their campus that are also passionate about it, that is more powerful than it coming out of a counseling center office. That's what's going to build that ethic of care at your campus.
Great. Now, the next question, we're getting a lot of questions about the international community. Can you provide some insight on serving the international or minority student populations on your campus specifically? Sarah, why don't you kick it off again?
This is very interesting, very timely, because we're actually getting ready to explore. We've had some challenges in terms of engaging an international student population, as they are tend not to be the individuals who live in our residential communities, because we have majority of our international students are actually graduate students. So we've been trying to be more mindful of ways that we can engage that population. So I actually, after this phone call, will be meeting with our Center for International Programs. So I will keep you updated on some best practices or what we find there.
And Layla or Kathy, any insight on serving your international populations?
Yes, and I think that's something that we also struggle with is, specifically catering to international folks. It's something that we are working on, and part of one of our programs is we in mental health first aid we do luncheons, and so the next topic for this luncheon for students is actually how to engage or how to have a conversation with someone who is not from here on mental health resources. So that's something that we are working on.
I would just add our international office, there's certainly different gatherings that they have, and there's a welcome certainly that comes when school starts in August, and we really make sure that we just, have a counseling presence there, and just in terms of getting to know, so that our faces are there and we can introduce ourselves, and so that has helped to, so if someone needs to, be referred to our office, that helps to bridge that, and they're more willing to come in and talk with a counselor.
Great, and I'm seeing some good questions around off-campus resources. This individual asked, how does this framework for supporting mental health initiatives apply to non-residential institutions? I think you each have a split between on-campus and off-campus. So, Dr. Zakarian, do you have any insight on this?
Again, we've mostly utilized Cognito with the first-year students, a little bit with the RAs, things like that. So we have not done that as widely with the off-campus students, but assuming that they're coming in, again, that's the beauty of having it with the first-year experience class, is that you're capturing all students regardless of whether they're on campus or off. As a first-year, when you enter the school, you're, expected to take that class. So We just capture us more initially, and that's where we would capture them.
Layla or Sarah?
Yes, sorry.
It's okay.
Okay. Sorry. So Cognito is mandatory for all incoming freshmen, but that's not to say that other students who are not on campus, or upperclassmen or graduate students can't take it. This is certainly a course that is inclusive for all students. And so we advertise it on our website. But yeah, like I said, it's just mandatory for incoming freshmen.
So it sounds like a follow-up to this webinar is how do we support students that are in the upper grades or graduate programs. So I think that's a further discussion down the road. I have a few more questions that are coming down the pike, and one of the last questions, how do you all build a large-scale, meaning reaching many students at once, interventions at the university level? Sarah, how about you start?
Of course. So I think, for us, in terms of building or reaching that critical mass, has really been us leveraging our residential curriculum. And, I know our Vice President of Student Affairs, Bill Fisher, was just talking about in terms of other initiatives. Like, we really rely heavily on that residential curriculum to do a lot of that institutionalization in terms of health and well-being. We just have so many students who live on campus, and then the majority of students who don't. We have so many of our graduate assistants across campus who interface with students, who then also are required to engage in Cognito as well. So by having those interdisciplinary teams complemented with the vast number of students who participate in the residential curriculum, we have truly institutionalized Cognito. Like, if you're walking across campus and you ask somebody if they've completed Cognito, they will at least tell you they have heard of it, which I feel is a huge win for us.
Great, thank you. Anything else from Dr. Zakarian or Layla?
Yes, I do think in reaching other students on a large scale attempt, I do think that what we do is we really strive on our relationship with campus partners because, especially the deans of students and the office of deans of students, they work directly one-on-one with students, and so and other campus partners that are part of campus and student life. I think they do a great job of advertising our resources. So getting or having a close relationship with other campus departments, I think is key.
Great. And one final question. We're approaching the top of the hour. I want to be respectful of everyone's time. The last question is specific to the Cognito experience. Do any of the universities, colleges requiring suicide prevention training like Cognito have issues come up with students who are triggered, or options for students who may oppose completing on time due to their own mental health at that present time? Have any of the panelists experienced individuals who self-identify or self-refer? How about we start with you, Layla?
There hasn't been any instance of that. We have had, before we made it mandatory for freshman students, we have had people from other departments contact us on, they've heard about Cognito, they see it on our website and wanting more information because they see that, it will help the student that they are seeing. But yeah, nothing specific to that.
How about Dr. Zakarian or Sarah?
I would say we've seen this more with sexual assault and sexual misconduct training. where people have come forward and have, more of an issue and concerns about completing that. We have not had it with the Cognito per se, but I would certainly, if we've told faculty though that if there are concerns like that, to refer them to counseling, and we'd be happy to, not necessarily for therapy per se, but to talk with them and see, offer, any support that might be helpful in lieu of taking that.
Ours is not, at the University of Dayton, is not required, although we have such high participation in it. So I'm assuming have students click out of it if they do not want to complete it. We have not had any phone calls, emails, anything like that about the content, because it's really been framed as, when people talk about the University of Dayton, if you ask a student what they value about it, they'll tell you it's the sense of community. So we've really leveraged, this is how we build that sense of community that you claim is so intrinsic to the university, and they really buy into it.
Great. Now, I wanted to just give some parting words from each of our panelists. Just any closing thoughts on the topic, where you see this going a year or 2 years down the road with your own institutions, or your vision of how we can support first-year students. Dr. Zakarian, why don't we end with start the end with you?
Sure. So we had this as, we were able to implement this as a part of our GLS grant, and finished our 3 years in October, and met with administrators again and built this into our sustainability plan for the efforts. And so this is one of the efforts that we selected that we wanted to carry forward and make sure that it doesn't end when the grant ends. So fortunately, they were able to support this, and we were able to sign on for another 3 years. So essentially, we plan to continue, with the same, because it had been so successful, being able to keep that going, even though we don't have the grant continuing.
And Layla from University of Chicago.
Yes, and I think, going back to the facets of wellness framework, we obviously know students are here for the intellectual facet, and they really neglect other facets of their wellness, their social, emotional wellness. And so that's really where Cognito aligns with this framework. If students are not taking care of their mental health, this can really affect their intellectual facet. It can affect their social wellness and their emotional wellness. And so I think for any schools that are interested or thinking of integrating Cognito, really, have the data to support it, because I think mental health is an issue for most universities, and show, have the data to support that this is beneficial for all students.
Thank you, Layla. And last but not least, Sarah, some parting words.
So I guess my biggest takeaways is really being able to make sure that when you're pursuing this, that it aligns with the mission and vision and the strategic goals of the institution. Here at the University of Dayton, we are getting ready to launch our first health and wellness global assessment. So I'm very excited. So that way we can do exactly what Layla has instructed in her parting words, is really take the data and use that to drive where we go next and how we can get the most out of this module and what it has to offer.
Great. Just some final words from myself. I wanted to thank each one of the panelists for providing some insights on their campus and what they're doing to support first-year students. I think one takeaway that I learned is how can we further the conversation and support all students. I would definitely like to see that conversation happen sometime soon. If you would like to learn more about Cognito, please visit our website at www.cognito.com. Till next time, thank you again for joining, and we look forward to seeing you guys again soon.